and to talk to their primary care physicians when necessary, but also to study and measure the impact on their on their health spending. So I think the key in the future.
What'd you find?
And we found that we were bending the cost curve. We reduced hospitalizations, reduced emergency department usage, improved specific health outcomes, got people thinking about health, got these small senior housing developments to start talking about health and being healthier and making it a hub of health and wellness, where it really hadn't been that prior. So clearly, reinvesting the savings is what we are hoping gets expanded to senior housing in the way that that's been done for supportive housing, especially here in New York.
Okay, so I mean, that's mostly about services, right, what you did, Vermont. I'm wondering just on can we talk for a second, turn back to sort of the financing of the actual housing, structure of the housing. So, Sidel, what sources of funds are critical for developing housing for seniors? You talked about their low and fixed incomes, and so is some kind of rental subsidy absolutely essential to make it work?
Absolutely.
Yeah.
I would say that, I mean, doing senior housing, you have to like all affordable housing, you have to piece together many sources of funding. But the project-based Section 8, I think, is the critical element because I think seniors, many seniors, as they age, their income goes down too, and they have less resources. There may be less family members that can help out, and so you really need that Section 8 is like a lifeline to people. They don't have to worry. And by the way, with the seniors in the Housing Authority, they didn't have to worry that their rent would go up. They were able to pay 30% of their income for rent. So it's a very key element. That being said, there are other subsidies that are critical. So we've used tax-exempt bonds and HDC and HPD funds, RES-OA funds from the city in addition where we've needed that. We've used NYSERDA money. We did the first Medicaid redesign project on East 99th Street that Jason was referring to, and we had $7 million of Medicaid redesign funds for that project. And then there are other parts to this, which is these collaborations usually involve city-owned land on 99th Street. We have a 99-year lease with the Health and Hospitals Corporation. And of course, that building, you cannot get into it unless you have a letter from the Health and Hospitals Corporation as a referral source. So basically, they are dealing with people who are chronically ill, people who were in nursing homes, who could live independently. The building is the first 100% handicapped accessible building in the city. And so we have 40 individuals who are basically physically challenged. They are quadriplegics and paraplegics. And we did all kinds of focus groups on how they could live in these apartments and design them, like having lower windows so someone in a wheelchair could actually see out. Of course, everything moves, kitchens all move. And I neglected to mention one other physical thing we've done in our buildings, which is showers. In this building, it's roll-in showers, but in other buildings, it's showers with a seat.
Right. So, but again, that's relatively cheap, right?
It depends. If you have to do a roll-in shower, you have to put a drain in the middle, and then this plumber says it's 2 drains, and you.
I was just going to ask you to jump in, but I'm going to ask you a question then you can, which is just, I mean, you're thinking a lot now, right? You're talking about developing senior housing, right? You do have land at NYCHA, right? You don't have a lot of money, last time I checked. And New York has not been Ann Griffith on the first panel talked about San Francisco's engagement with the RAD program. New York has not been a big participant in RAD. So I'm wondering, how are you going to do this?
Sure. So as part of next year in NYCHA, we actually have, there are 15 strategies, and I'll talk specifically about the development strategies, which really sort of fall into 3 lanes. The first is a new construction program that's 100% affordable. We have 3 RFPs. We had 3 RFPs on the site, on the street. We just received more than 25 responses, which is really exciting. And we know through a really different and engaged community process that took place last summer, that in 2 of those locations, the residents really want to see senior housing. That was sort of the deal for them, which is if they were going to support development within their community, they really wanted senior housing. They wanted to remain in their community. They wanted to also have an opportunity for mixed use, such as like federally qualified health centers. They were very sophisticated in their asks in terms of the types of services that they would see, that they want to see in this future development. So those are the first 3 sites of many that will sort of be being released over the course of the next several years. So that is 100% affordable. It'll be contributing to the mayor's broader affordable housing goals of 200,000 units over the next 10 years. I think the other piece, just to sort of underscore something that Sadal mentioned, which is, our ability to support these types of partnerships, including the land, is via project-based Section 8 or actual Section 8 vouchers. And we are, sort of hopeful that given how Section 8 funding is trending, that we'll actually have the ability to begin to issue some new vouchers in the next year. And so how we utilize those vouchers to both meet a number of different demands, including the homeless crisis, but also squirreling some away for our development program is something that we're really looking into. So the 100% affordable program is moving forward. The second lane is our 50/50 program, which is really an opportunity to generate some revenue for the authority while also preserving and creating more affordable housing. So about 7,500 units we expect there. Half will be 60% AMI at a minimum, and then 50% market. The third lane, which is something that I'm excited about all of it, but I'm really excited about this lane, which is our preservation sort of space, which is sort of looking at those units that represent about 20% of our overall capital need, but only 6% of our portfolio. Those really, really expensive units, those single-family units, those sort of obsolescent units. We've had some very early conversations with HUD, really talking to them about how do we utilize not only RAD, but really every potential federal tool to help preserve those programs. The questioner asked earlier, can we talk about preservation? This is what we're trying to do. We're actually trying to preserve an aggressive preservation approach to public housing. We have one RAD application that has been accepted, 1,400 units out in the Rockaways, and we expect that we will have we know we have a very significant pipeline of additional RAD applications. Look, I think this is one of the signature Obama housing initiatives. They'd love to do it in New York. We want to do it in New York, and we certainly, it represents a huge step forward in terms of potential capital. I think the question around services remains the challenge, and so I think that's where we really need to think about how we can be creative in that space as well.
Great. Okay.
We actually, I think, one thing on
very
financing.
Quickly.
What happened to 202? It's gone. It's like that. It just disappeared without much fanfare, without much outrage. It just sort of stopped. So I can say leading age partners around the country are going to be asking that question in the next budget cycle. If not 202, then what?
So questions from the audience. So I'm going to try to do the 3 like David did. Can't, so I can see one hand back there. I see another hand back there and another hand there. So there's 3. Yep. So just quick question, because we are...
Nancy Eldridge, National Center for Healthy Housing. With the huge growth in the senior population, I really think we need to move to much more of a systems approach of reform. And I think the medical homes in this country under ACA have really created a good model in terms of multi-payer pools. In the prior panel, we talked about the problem of payers, both public and private, being silos. And so I'd like to ask the panel, could we have housers going to insurance commissioners, regulators at the state level, and Medicaid and Medicare to create a multi-payer pool to support true service delivery for seniors using affordable housing as a hub and a platform.
Okay.
Thank you.
John, I think that's for you, but let's take 2 more questions.
Yes, my answer to that is yes.
Okay. I may ask you to elaborate, but where were the other questions?
Here we go. Sorry,
sorry.
Ryan Frederick, Smart Living 360. One quick comment and a question. You know, we spent a lot of time talking about affordable units. I want to mention, as we think about the future, we have a large population of people that are living longer, that don't have pensions, that aren't necessarily on the verge of being dual eligible, where we have a lot of the same challenges ahead, and we'll also need to find out vehicles for financing. So just put that aside, comment. Question for you, you know, we live in this dynamic world, and so as mentioned earlier, John, you talked about the evolution of the service coordinator. The question I have for the panel is, what role is there in technology bending the cost curve here? You know, clearly there's, if we save money in healthcare, that's a benefit like we talked about earlier, but where can technology be part of, I don't know, housing 2.0?
Okay, and I think Sidel, that's for you, probably. Okay. So.
Hi, Candace Baldwin with Capital Impact Partners. I've been working on this issue for about 25 years, so thank you for having an actual conversation about it. A question that I have is, we've talked about healthcare systems today, and I know that, your name is escaping me, Sidel was talking about a PACE site. We haven't talked about FQHCs, federally qualified healthcare clinics, and the co-location of those things. I think, you know, set aside pay for success, there's opportunities where housing providers who are developing space, you know, creating that commercial space. And so we've been financing those types of things, but I wanted to know, where do those play a role?
Well, that one's for Shola, so that's very good. So John, do you want to talk about this, this question of a multi-payer pool?
I just want to say, great idea. Nancy, as usual, another good idea. I think that's something we should address and try to work on.
And you're optimistic? It's okay. All right, let's move on. Technology, Sidel.
So technology can be a double-edged sword. I'll tell you about one of the areas that we've struggled with, which is the question, what if somebody falls in the living room where we do not have, they don't have access to a pull cord button, and what happens to them? And we actually talked to a number of high-tech companies about, you know, they said, well, you can monitor people from far away, and we said, well, you know, there's privacy issues kind of in telling somebody you are monitored, and so that is one thing. We know that there's a solution somehow to this. We've talked about people, you know, getting residents, buying them sort of those portable buttons, but frankly, they're very, very expensive, and people can lose them. We see how seniors lose our sort of electronic keys. So that's one technical area. The other area is security that we've been very involved with in trying to kind of figure out the next level, and we've started with no video cameras. We've been trying to figure out what's the next level that people can actually work with and that presents security, but also allows people the flexibility to use all the services that are in the building and be able to use it with a key fob. And so these are all ongoing problems, and part of the problem is that seniors are not very adept at high tech. So, and you know, certain things, even things like thermostats. I mean, we've had to pull out thermostats that nobody actually on our development team could figure out how to use. So there's a lot of, I think high tech is going to have some answers. I think the privacy questions are very, very important and critical ones. Yeah. You want to keep people, when you talk about people living with dignity in their own place, you don't want it to look like there's just Big Brother is watching you, even from a security
good point.
And just to add to that, I think while technology is hugely important, and you know we would certainly welcome anyone who would like to invest in the New York City Housing Authority and help us do that. But you know, I think for us, one place where there's a lot of opportunity is actually supporting the informal networks that do exist within our communities. There are, and it's different in different developments, a very sophisticated system of floor captains and building captains, and oftentimes though the strongest of those types of networks are places where the floor captains, they have a place to meet. They have a, they have a place with a table and a door. And, so in some ways, yes, technology is really important, but there are also some very sort of low cost, very simple ways in which to continue to foster those types of informal networks. I think the question on the federally qualified health centers, so we have a lot of space. We have about 1.5 million square feet of non-residential commercial space that used to be, former community centers, senior centers, perambulator rooms, you name it. We have all this types of space, and it goes sort of right at the core of our vision of creating clean, safe, and connected communities, and many of developments, though there are these huge sort of dark spots, right, where those spaces were brought offline for a whole host of reasons. So one of our strategies is actually to map that space, because it's actually quite interesting that we don't know where it all is, and then to develop a series of typologies so that we could actually make those spaces attractive to potential users like federally qualified health centers. Our residents are very clear about what they believe they would like to see in their neighborhoods. In a number of our communities, we are health deserts. There's food deserts, so there are health deserts, Brownsville being one of those areas. And so actually one of the potential uses out there is to actually encourage a federally qualified health center to utilize some existing space. So we are sort of open for business for that type of potential user in our space, and also connecting it to the needs, i.e. going back to your question around data, where we have sort of large concentrations of older adults or folks who are potentially medically frail. Just a sort of another side note is, something that happened post-Sandy at the Housing Authority, we had not had a real handle on who were those medically frail residents within our portfolio. And to the credit of our colleagues, my colleagues at the Housing Authority went through a pretty extensive process to identify every single person who has medical needs, who needs oxygen, has limited mobility issues. And so that's a huge sort of data and treasure trove, and could be a sort of interesting match for a potential healthcare provider who's looking to serve that population.
Yeah, that's a good point. So,
Can I just comment on one thing?
Where are we in time? 5 minutes? Okay, perfect. Yes.
I just wanted to comment on basically one of the issues of financing, and that's the community service space. And so we jump through hoops with our tax credit investors to try to finance the shell of the community facility space within the tax credit envelope. And it's very hard, the fit out of those spaces to do that, so that you can't, it's part of the support service is just as hard for the operating of those services, but just the fit out where a commercial kitchen is an expensive item, for example. So that is one of the areas that's really of great need. I mean, you don't want to do a new market tax credit if you could for that piece of it. You want to try to kind of find a way to finance those, because you can upfront, we're always scrambling, and we're asked, what are you going to do with this space? And we say, we're not sure yet, because really we don't have the financing to invite people to come in and use that space. And so we're always trying, it would be great at the beginning to be able to say there is a source for financing a senior center, the real capital needs of a really great senior center, or a PACE program, or of any other type of an adult day program, a mental health clinic, and just what the providers have to do to jump through hoops to get that done is very, very intensive, and it doesn't follow the clock of projects under construction. You suddenly got the funding to do a senior center, and they have a commercial kitchen, and now you didn't have that in your plans. So now you have to go back to the Department of Buildings in the middle of the process and go, well, we have to make certain changes, which are very significant. Your GC is just beside himself, yelling about the cost, et cetera, and it really can slow things up. So that's a very key piece.
That's an important piece as well. So I think we have time for one more question, one quick question. Yeah. Oh, sorry. There you go.
Thank you. On the services side of this equation of the pairing of housing and services, There are lots of programs that exist currently funded by the city, socialization programs, care management programs by the state, home care programs, care transitions programs, all that more and more are targeted at reducing the costs of Medicaid and Medicare. What recommendation would be, there's no question here, is that we need...
Do you have a question?
Yes, could we please have...
Maybe, how about
a,
asking the panel what they think?
I would like to ask John.
If they had one recommendation for sort of how we move forward on
Radical
this.
expansion of all of the services just listed there.
So the question would be to John, do you think it's possible to have a state and city champion that can pull together the service components that exist presently to serve seniors and to create a breaking down of those silos so that the resources already being expended could be targeted properly?
Stuart, I think that process is underway, and I think that New York can be a national leader in making sure that those silos continue to be reduced and that those sectors continue to work together.
So, great. Well, I think that's a good note, a good hopeful note to end on. So please join me in thanking this terrific panel. And I think, Terry Ludwig, you're coming up next. Great.
So hi, everyone. I'm Terry Ludwig, and I am the wrap-up hitter for tonight. I believe it's time for drinks, for sure. We've kept you in this room. But I was just really excited to be able to do a quick recap. Really appreciate everyone joining this afternoon. And can you just join me in giving all of our panelists a big hand? What a great conversation. I'd also just like to take a moment to thank our partners. Here we are at the New York Fed. What a great space and great set of partners with also San Francisco Fed, your leadership, and of course, NYU Furman Center. So thank you very much for the collaboration. Yeah. And there's no doubt we're all here today because we share an important understanding that home has a profound and lasting impacts on our health. I think today's conversation just reminds us of just how important that is. And we also know that, in particular, the implications for low-income families that we serve it's outsized effect for these low-income families. So I could spend a lot of time going through data. I had some talking points. I'm throwing those away. I'll take us back to the data we just saw on the screen earlier today. Pretty unbelievable charts, and just maybe one data point, but we know that families that are not stably housed, low-income families, spend 39% less on food than otherwise stably housed families. We also know they spend 65% less on health care. So if we just kind of look at the bottom line of all this, and we look at these charts, we know that this is really, really important stuff for the life expectancies and the health of the families we serve every single day. We've heard many people attributed to this quote, including the head of the Centers for Disease Control and Prevention, but that your longevity and your health are more determined by your zip code than they are by your genetic code. So these headlines will leave with us as we leave the room and just know just how incredibly important this is. Heading up enterprise, we've been at this for over 30 years, and there is absolutely no doubt that we know that there's just a completely clear relationship between home and health, and that our work has to have a health lens. And I was just saying earlier that it's interesting. It's also pretty organic in the communities we serve. If you care about low-income families' well-being, the health is right there. And we just kind of went through a strategic process of looking, well, how much, what are we doing across the country in health? And it was over 40 different initiatives, because we also know one of the big challenges we have is that we have to be locally relevant. The needs are different on the ground. So we also have this really critical challenge that we see at Enterprise, but we see it with all of our partners, which is how do we make sure that we also have attention and focus to the pilots that are really going to matter? How do we share best practices? How do we look at the systems change that's going to be necessary here to scale? And how do we take on some unusual alliances and collaborations that will make us all stronger and think differently? So I think those are the things. Today's conversation really focused on some of the capital resources and unlocking those capital resources.